Understanding clinical trials. What follows is a consent form for a trial that is not being carried out right now, but for which you might be eligible if it were. Each page will include narration. Following the narration, please take all the time you would like to review the text, and then proceed to the next page when you're ready. The title of the research study is XA100 as Adjuvant Therapy for Intracoronary Stent. The principal investigator is Dr. Christopher, and the study sponsor is Xancor. Why am I being invited to take part in a research study? You are being asked to participate because you required stent treatment recently following an acute coronary syndrome, or ACS. What should I know about a research study? Your participation is entirely voluntary. You do not have to be in this research study. If you join the study, you can stop or leave at any time with no changes in the quality of the health care you receive. You will be told about any new information or changes in the study that could affect your willingness to continue participation. Why are we doing this research study? The purpose of this study is to test an experimental medication called XA100. We want to find out if it works and test its safety. We want to find out what effects, good or bad, it has on people with your condition. XA100 is a new class of medication that has been shown to lower the levels of an enzyme released by blood cells that is believed to contribute to inflammation and the progression of atherosclerosis, plaque buildup. People with higher levels of this enzyme have been shown to be at greater risk for heart attack or stroke. It is thought that by lowering the levels of this enzyme, XA100 may lower the risk of a future heart attack, stroke, or other cardiovascular event in patients like you. Xancor is the company that created and makes the experimental medication XA100 and other medications. XA100 has not been approved by the U.S. Food and Drug Administration for sale by prescription. XA100 has been tested in animals, in healthy people, in patients with coronary heart disease, and in patients at risk of developing coronary heart disease. How long will the research last? We expect that you would be in the study for up to 5 years, requiring approximately 15 outpatient visits. How many people will be studied? We expect about 70 people would be in this study at UMass Memorial Healthcare, out of 500 people in the entire study nationally. Will I definitely receive the experimental medication? No. You will get either XA100 or a medication called Zembello, which works through a different mechanism to reduce plaque and is an approved medication sometimes used for patients with your condition. The decision to give you XA100 or Zembello will be made by chance, like flipping a coin. Neither you nor the study doctor will choose which study medication you get. You will have a 50-50 chance of being given XA100 or the approved medication. Neither you nor the study doctor will know which study medication you're getting, but in an emergency, a doctor can find out what you're taking by calling the on-call investigational pharmacist. What happens if I say, yes, I want to be in this research? You'll have the following tests to see if you meet the requirements for being in the research study. If you've had some of them recently, they may not need to be repeated. That would be up to the study doctor. You'll have a health review where we'll ask about your health, lifestyle, sleep habits, and any illnesses and medications you're taking. We'll ask about the ethnic background of you and your parents. We'll check your weight, height, blood pressure and pulse, and measure your waist, hip, and neck size. We'll draw blood from a vein for lab tests, and you'll be asked not to eat or drink anything other than water whenever possible for 9 hours before most of these blood draws. We'll take a urine sample for lab tests. If you're a woman and can have children, a urine or blood test will be done to see if you are pregnant. If you are pregnant, you can't take part in this study. What happens during the study? At the first visit, you'd be given a supply of your study medication, either the experimental medication or the approved medication for this condition, depending on which you were assigned to take. This would be taken once a day with food according to instructions. The study medication is a tablet that must be swallowed whole. Do not chew or crush it. You'd be asked to have the following tests or procedures done to see how the study medication is affecting your body. You would receive a complete physical examination, including checking your blood pressure and pulse. An electrocardiogram would record the electrical activity of your heart. And blood tests. We would draw blood from a vein for lab tests. You'd be asked not to eat or drink anything except water if possible for 9 hours before these tests. You'd need to come to our clinic about 15 times during the study, having about 4 visits during the first year and about 2 visits per year until the end of the study. You'd also receive telephone calls from the study staff twice each year. You'd be asked questions about your symptoms, daily life, and any help you may need in taking care of yourself.
What happens after the study? When you have finished taking the study medication, you will need to come in for a follow-up visit. You will need to come into the clinic for one scheduled visit about 35 days after you take the last dose of the study medication and return any unused study medication. You may be asked to have some tests and procedures to see how the study medication affected your health. If you permanently discontinue treatment prior to the end of the study, then research staff may follow up with you by telephone visits or other means about every 3 months until the end of the study, unless you withdraw your consent. Each telephone contact will take about 5 to 15 minutes. After the study is finished and all the effects of XA100, both good and bad, have been compared to the approved medication, we could tell you which study drug you took if you desire to know.
Below is a schedule of study appointments and procedures. In the left-hand column, you'll see a list of all the procedures that you'll be asked to do during the study. The top row lists all of the times you'll be contacted while in the study. A check mark tells you what procedures will happen at each visit. Please take all the time you would like to review it and then advance when you're ready. What are the risks of being in this study? Risks of the experimental medication include the following side effects of XA100, which have been most commonly reported: unusual smell or taste, temporary skin discoloration, diarrhea. These side effects would likely go away when the medication is stopped. Other rare but serious side effects could occur. Call your doctor right away if you feel very tired or faint, feel pain or sick in your stomach and do not want to eat, bruise easily or develop itching, have yellow eyes or skin or dark urine, become confused, or have a worsening of asthma symptoms or allergies. You can't join the study if you have severe asthma or a history of severe allergic reactions, for example to food, medicines, or latex. In addition to these side effects, studies in animals showed that fatty deposits could collect in the internal organs after higher doses of the experimental medication. However, there was no evidence of these changes in tests with people taking the medication for up to 1 year. In studies with animals, where much higher amounts of the experimental medication were used, there was an increased risk of cancer or tumors. It's believed that was a result of a byproduct that can form if the medication dissolves in the stomach. This risk of harm to you is thought to be extremely low because you'll get the study drug in a tablet that is coated to make it very unlikely to dissolve in the stomach. This means it's not likely to form the byproduct. You may experience other unforeseen side effects that have not been reported before for XA100. For example, as with any new medication, there may be a risk of allergic reaction that could include rash, hives, itching skin, difficulty breathing, lowered blood pressure, swelling, and even death. If you experience any of these symptoms, contact your study doctor immediately or seek emergency care. You will be immediately treated with standard medicines used to treat such reactions.
Risks of the approved medication. The following side effects of Zimbello have been most commonly reported: muscle or joint pain, diarrhea, and upset stomach. These side effects would likely go away when the medication is stopped. Other rare but serious side effects of Zimbello could occur. Call your doctor right away if you have yellow eyes or skin or dark urine, become confused, experience memory problems, develop hives or itching, experience severe muscle pain or weakness, or experience numbness, tingling, or pain in your hands or feet.
Other potential risks of participating in the study: The risks of having blood drawn include slight pain when the needle is inserted. You may develop a harmless black and blue mark, and your arm may be sore. Occasionally, some people feel dizzy or lightheaded when blood is drawn. They may become sweaty, feel cold or tingly, and may faint or throw up. Risks that are possible but unlikely include infection, nerve damage, and puncturing an artery instead of a vein. The risks of electrocardiograms include skin irritation and a rash from wearing or removing the patches that stick to your skin or from the gel that is used with them. Your condition will be watched closely during the study. If you have any serious reactions or problems, the treatment will be changed or stopped to protect your health. An additional risk of being in this study is that your personal information could be lost or exposed. This is very unlikely to happen, and we will do everything we can to make sure that your information is protected. What are my responsibilities if I take part in this research? If you take part in the research, it's important for your safety that you follow the directions of the study doctor and research staff. There are certain medications you can't take while on this study. Tell your study doctor and staff about all medications you're taking now and any new medications that are prescribed to you. Tell your other healthcare providers that you're in a research study. Do not drink more than 1 glass of apple juice each day. Do not use illegal drugs or incorrectly used prescription medications. Will being in this study help me in any way? You may not benefit directly from being in this research study if you're assigned to take the experimental medication and it doesn't prove effective. It's hoped that XA100 may reduce the risk of a future heart attack, stroke, or death, but we can't promise that this will happen. However, the results of this study may help others in the future. Will being in this study cost me any money? There will be no additional cost to you from being in this research study. The medicines, clinic visits, and tests that are done for research purposes will be free. Any costs for the standard treatment of your condition will be billed to you or your health insurance. What happens to information about me? We'll try to limit access to your personal information, including research study and medical records, to people who have a need to review this information. We cannot promise complete privacy. The UMass Institutional Review Board, the study sponsor, and the U.S. Food and Drug Administration could inspect our research records to assure the study is being carried out appropriately. Your name will never be used in any results of the study that are published. If you test positive for HIV, hepatitis B, or hepatitis C, these test results will be reported to the local Board of Health and Massachusetts Department of Public Health as required by law. What happens if I'm injured because I took part in this research? If you're injured while in the study, seek treatment and contact the study doctor as soon as you're able. If you're injured or have any harmful effects as a direct result of the administration of XA100 or any procedure required by the research, necessary medical treatment will be made available to you at UMass Memorial Medical Center. The sponsor, Xancor, will pay the reasonable and necessary medical costs for study-related injury that is not eligible for billing to your medical insurance. The sponsor has no plans to pay for medical expenses for injuries that are not directly related to your research participation or that are caused by the natural course of your disease. The sponsor has no funds set aside for any additional form of compensation in the event of a research injury. You do not give up any of your legal rights by agreeing to enroll in this study. Will I be given any money or other compensation for being in this study? Yes, you'll be reimbursed for your time, travel, and other expenses associated with this research study. You'll be paid $75 at each clinic visit. If you complete all study procedures, you'll be reimbursed a total of $1,125. In addition, free parking will be provided to you for all your clinic visits during the study. Xancor will be the owner of the study data. Xancor plans to use the results and may get patents or sell the medication in the future, or make profits in other ways. You would not be paid any part of this. What are my other options? You do not have to be in this study. If you decide not to be in the research now or later, it will not affect your usual care and it won't be held against you. Instead of being in this research, you may continue to get regular care from your doctor, which may include being prescribed Zembello, the approved medication being compared to the experimental medication in this study. Talk with your doctor about your choices. What happens if I say yes, but I change my mind later? You're free to leave the study at any time. There are no penalties, and you do not lose any benefits to which you are otherwise entitled. Below is a list of procedures for withdrawing from the study. Can I be removed from the research without my permission? The person in charge of the research study or the sponsor can take you out of the study even if you don't want to leave. This may happen if the investigator decides that continuing in the study would be harmful to you, if you need treatment not allowed in this study, if you fail to keep your appointments or take the medications as instructed, if you become pregnant, or if the study is canceled by the company making the medication, the FDA, or the UMass Institutional Review Board. Whom can I talk to? If you have questions, concerns, or complaints, or think the research has hurt you, you can talk to the research team at this number, or contact someone from the UMass Institutional Review Board at the phone number or email listed here. Thank you for taking the time to review this presentation. Please click here to complete a brief survey.